Hi, I'm Dr. Jay Hobbs. This is your Synergy Pain Prevention Tip. Oh, start over. Okay. Hi, I'm Dr. Jay Hobbs. This is your Synergy Pain Prevention Tip. We're going to talk about vacuum cleaners and sweeping and your back pain, neck pain, and shoulder pain. But before I do, let me change. So I frequently say that if I can teach you how to do something for yourself, instead of having me do it for you, that saves you time, money, and disability, well, let's do it. That's the purpose of Synergy Pain Prevention Tips. If you vacuum or mop and you want to know how to prevent pain in your neck, your back, or your shoulder, this video has some most helpful ideas and demonstrations. So, what is there to vacuum, right? You just grab a hold and you start going. Well, it's that simple to get things clean, but not necessarily to keep yourself from being injured. This is a really common way to injure your back and strain your neck or your shoulder. I mean, you've probably done it yourself, but you just see how much there's all this force here, and then if I am twisting, that's when it puts more stress on my back. So it can slow your recovery from lower back injuries, neck or shoulder injuries, as well as start an injury. I frequently have patients that share how they were doing so well until they, well, you fill in the blank. And the most common endings to these sentences are vacuuming, sweeping, sleeping, going on long drives. And here we discuss vacuuming and sweeping. This can also be applied to mopping. So first we have our approach to our posture. Think of it as fencing. You know, fencing, that sport where you step out there, and I don't know how to do that sport, but you've seen them on TV, right? It's a posture that is, it's an attack posture and a defense posture. It's a stable posture where you can do whatever you need to do. So think of vacuuming, sweeping, mopping as a sport, really. You need your abs tight and your spinal muscles tight. Not terribly tight. You don't want to wear yourself out, but they're firm. Not an extreme, just firm. You're aware of them, holding your body steady, stable. And a broad stance. Okay, one foot in front of the other. As you grab your weapon, okay? Front leg is the leader. And the back leg is your foundation. That's where the power comes from. And the front leg leads the way. Okay? And your elbow is close to your body. So if your arm's out here, that's when you really start to strain the shoulder. And the shoulder, of course, anchors to the spine, so that strains your upper back and your neck. So elbow close to the body, spine upright, your core tight, foundation of your back leg, and your front leg leads the way. Okay, so it has to be as if you are one with a vacuum. Like you're vacuuming with your front foot. So here's our front foot. I'll go to the side a little bit here so you can see. So we step out and vacuum. Bring it back. All right? The movement forward is driven by the step of your leading leg. So if we're left-handed, so step forward driven by your leading leg. A movement backwards is usually driven by your leading leg, or it can also be by your back leg. But your whole body moves at once. It's not move out there, it's not move this and then move toward it. It's as if you were one unit. Okay, this can really help quite a bit, keeping everything tight, moving straight forward and backward. Now what about turning? Again, it's as if you are one with a vacuum. You should not turn it all without your whole body turning. So you don't turn it out like that and go around that corner, right? Because your elbow is not at your side. Keep that elbow at your side, and if you need to turn it, you turn as a unit. Okay, vacuum out there, and don't do that, okay? If you need to come in, sometimes this is tough, and it can be switching arms. You want to go a little extra mile to save the extra pain. So sometimes it's a little difficult, a little arduous to do a little extra work, switching hands or moving around, but a little extra time will save you a lot of extra suffering. What about special movement? Going up the stairs. Well, use those attachments and carefully carry the vacuum cleaner as little as possible and as one unit with your body. So if you have to pick it up, keep it close. So you don't want to hold it out there. That puts all that extra stress on the lower back and the shoulders. Keep it in close. Bend those knees, all right? Lift it up, walk up those stairs. And then you can use the extra weapons you have. Attach it to the hoses on your vacuum cleaner. Get it as long as you need. And then you can work up the stairs quite a ways before you ever have to go up there. Again, same concepts. You don't want to be doing it like this, okay? You do want to get as close as you can to it. So not way out there. Get as close as you can. And move as a unit with your body as much as possible. And with a broom, what do you do there? Same sort of concepts. Alright, so instead of being out there, look at all that force that's being put in my lower back as I do that. So you want to use your whole body. I'm not using my arms like this very much. It's mostly my body. Okay, a little bit of arm at the end. Same thing with the other side. Using your body as a unit, as a core. It's like this is a sport. If you treat it that way, you'll actually get exercise out of it and not injury. So, treat this like fencing. Good broad stance. Leading leg moves the vacuum. And leading leg comes back as you pull the vacuum back. Tighten the core muscles. Elbows close to your body. There you've got it. Enjoy this, because I know you enjoy your mopping and your sweeping and your vacuuming. But if you treat it like exercise, you can really see this as a benefit, not as a detriment. I hope this has been beneficial for you, and I'll see you on the next Synergy Pain Prevention Tip.